As the radiology PACS administrator for Manatee Healthcare System, I oversee the day-to-day operations of our radiology PACS for 2 hospitals and 4 outpatient imaging centers. We recently transitioned 4 of our imaging centers from the PACS that they were using before we acquired them over to our current Sectra radiology PACS. We thought it was important to have one PACS system for the whole enterprise, just for ease of use when it comes to the radiologists, technologists, clinicians, referring physicians, just everyone involved, so there's just one system to go to instead of having to learn multiple systems. Our PACS is integrated with Cerner and allows the clinicians to be able to launch images in PACS right from Cerner. And that gives any clinician on-site or off the ability to review patient images and their radiology results from all their history from pretty much wherever they are. One thing that we recently added was Sectra Connectivity Hub, which allowed us to add on 4 of our imaging centers that had a completely different EMR than the hospitals do. And the Connectivity Hub, it seamlessly combines and merges and lets you have disparate patient medical record numbers. Having one patient folder is good, so if the radiologists need to do comparisons, they're right there ready for them. They don't have to go searching for them. If the patient requests images, we have to send images to another facility. It's just everything's in one place and we're not missing anything. Training, we did a little bit in-house, but we also had some professional service hours from Sectra. People come on site to sit with the rads and get them up to speed. Since moving the imaging centers over, the feedback's been very positive between the radiologists and the technologists. Not a huge learning curve. They find it easier to use and better workflows than the previous system that they had. The technologists as well, they like it. It's easier for them in some ways that it's a one-stop shop. Before they used to have different features like documentation and separate programs. Now it's all in one program. As far as infrastructure, overhead, servers, software, everything that costs money, it's just better having one system. And this system's robust enough, it just keeps growing and growing with us, and it's easy, it's scalable to increase with volume. Anytime we've ever need to call the service desk or Sectra help desk, it's quick to answer, usually quick to solve the issue. If the person we're talking to can't, they'll escalate quickly as well. One cool thing is the proactive monitoring that they have. So we'll get alerts, they'll get alerts if something's about to happen or did happen, and make sure we get it resolved quickly. As a community health system, we feel as though we get some great attention and business relationship with Sectra. And we're not nickel and dimed. If we need to do upgrades, they're very responsive and attentive to help us get what we need and being there. I've been a PACS administrator for almost 20 years now. I've administered my fair share of PACS, and Sectra is by far the best I've seen, just as far as the end user's experience and technology-wise. My advice to other PACS administrators would definitely give Sectra a look. From implementation to upgrades to just end user experience, it's a great product.